Hey guys, this is Dr. Hub. In case you haven't subscribed, please do subscribe to learn and grow daily. Now let's understand the vasculitis and the site of involvement plus the site of involvement. So first we'll talk about the giant cell arthritis, and let's look at the headings we are going to talk about. So we will be talking about the aorta. Next we are talking about the medium sized arteries, then the small sized arteries, then the capillaries as well as the veins. So they are the categories we are going to talk about. So the first one being the aorta. So in giant cell arthritis, the aorta, is it involved? The answer is yes, the aorta is involved. What about MSA? MSA, is it involved? The answer is yes, it is involved. And SSA and capillaries and veins, the answer is no, it is not involved. Next we move on to the next topic, that is the granulomatous with polyangiitis. So the topic under discussion is the granulomatosis with polyangiitis. Polyangiitis, and this is nothing but the vagus granulomatosis. So the answer here is medium sized, is it yes? The answer is yes. Small sized, is it yes? The answer is yes. And capillaries, it can be, so it can be plus or minus. The aorta and the veins, it is negative. So this is about the granulomatous with polyangiitis, that is a vagus granulomatosis. Next we jump into the Church-Strauss syndrome. So let's write it as the CS syndrome. So what about the involvement of these vessels? So in case of the aorta, the answer is no, it is not involved. And in case of medium-sized arteries, yes, it is involved. And small-sized arteries, yes, it is involved. Capillaries, you can say it may be involved, and veins, it is not involved. So this CS syndrome, that is Church-Strauss syndrome, is very similar to that of the granulomatous with the granulomatosis with polyangiitis, that is a vagus granulomatosis. Next, let's look at the pan. So here in the pan, there is involvement of the MSA and the SSA, the medium sized arteries as well as the small sized arteries. Whereas the aorta, capillaries, and the veins, they turn out to be negative. Then moving on, we look at the leukocytoplastic vasculitis. The leukocytoclastic vasculitis. So under this, there is yes for the small size arteries, capillaries, as well as veins. So this is about the leukocytoclastic vasculitis, and there is negative for the MSA and the aorta. Then moving on, we look at the Buerger's disease. So Buerger's disease is Buerger's, Buerger's disease. So this Buerger's disease, there is positive for the MSA, there's positive for the SSA, and there's positive for the veins. The aorta is negative, the capillaries, it turns out to be negative. Next, moving on, we look at the Behçet's disease. So Behçet's disease is BEHCET, Behçet's disease. So in the Behçet's disease also, it follows a similar pattern to that of the Buerger's disease. That is, the MSA is involved, the SSA is involved, and the veins is involved. And here, in addition to that, in Behçet's disease, the capillary is also involved. So Behçet's disease is not involvement of the aorta. To watch more videos like these and grow daily, subscribe to the Dr. Hub channel.